Rabies, hydrophobia, Lissa, mad dog disease. Rabies is acute viral and fatal encephalitis of all warm blooded animals characterized by 1. Altered behavior to aggressiveness. 3. Progressive paralysis and 0.4 in most species by death. It is an important disease of men and animals, which is usually transmitted through the bite of rabies animals too. Other animals or human result in rapid fatal encephalomyelitis after a somewhat lengthy incubation period. Caused by a lysovirus. Manifested mainly in either a furious or dumb paralytic form, the infection originates in a bite wound. A nerve trunk equals the cord and brain. The incubation period is variable and, on occasions, has been longer than 6 months. Etiology: rabies virus, a labile single-stranded RNA virus. Genus: Lysovirus. Family: Rhabdoviridae. Variants of the classic rabies virus have been identified. Molecular techniques: Lagos bat virus, Macola and Duvenhage virus Africa, European bat virus 1 and 2 Europe, Australian bat virus Australia. There is only one immunotype of the virus. FA reagent is prepared from a pool of monoclonals of different variants. It is thought that the standard FA test will identify the variants. Distribution occurs worldwide. Except for Australia, a rabies variant virus recovered from bats, New Zealand, the British Isles, US and Canada, the Scandinavian countries, Cyprus and Japan. All domestic animals, mammals are susceptible. It is frequently endemic in wild animals including the skunk, fox, raccoon, wolf, bobcat, and jackals. Asymptomatic salivary gland infections occur in vampire bats resulting in prolonged viremia. Insectivorous bats may also be infected. Susceptibility. The various animal species vary in their susceptibility. Very high equals wolves, coyotes, and jackals. Moderate equals dogs, cats, humans, raccoons, bats. Low equals American opossum. Mode of infection and transmission. It occurs primarily through contact with infectious particles in saliva via bite wounds or contamination of mucous membranes or open wounds. The virus is shed in the saliva from infected salivary glands. The disease almost always results from the bites or scratches of infected or rabid animals. Several cases in humans have resulted from aerosol exposure. Other minor sources include other body fluids, particularly urine, airborne virus, or ingestion. Clinical signs. The incubation period is usually 2 to 8 weeks but can be several months. The course is 3 to 10 days. The disease is seen in the 3 forms. However, these forms are not always clearly demarcated. 1. Prodromal form. Animals show only vague CNS signs, which intensify. Rapidly, animals show apprehension, anxiety, and changes in temperament and behavior, barking at imaginary objects. Severe pruritus equals at the site of exposure. This stage lasts from 1 to 3 days. Paralysis ensues rapidly and death occurs within 10 days after the first signs are seen. 2. Furious form. Aimless wandering. Bumps into objects, excitement, irritability. Bites or attempts to bite animals, people, and inanimate objects. Mad dog syndrome. Depraved appetite, voice altered. Muscle paralysis, salivation. Convulsions, ataxia, paralysis, and death. 3. Paralytic form. 1. It is most common. To the animal is lethargic and hides. Does not usually bite. Point 3. There is muscular tremors. For perceived difficulty in swallowing. Point 5. Terminal paralysis. Paralysis of the throat and masseter muscles dropping. Of the lower jaw or lower jaw paralysis is the clinical signs common in dogs. The paralysis progresses rapidly to all parts of the body, and coma and death follow in a few hours. 4. Anaperant form. This form has been observed in dogs, cats, skunks, and bats. These animals may seroconvert, survive, and serve as a source of the virus for extended periods. Bats may be asymptomatic or have protracted clinical signs with transmission of the virus for months. Diagnosis. A. History. History of a recent bite wound and classic clinical presentation may be helpful. History of exposure to potentially infected wild animals should be considered. B. Clinical pathologic findings are non-specific. C. Antemortem testing may confirm RV infection, but cannot adequately rule it out. D. Owing to the serious public health implications. Euthanasia of animals suspected of RV infection is urgently recommended and often required by law. E. Post-mortem testing confirms or denies the diagnosis. Submit the brain chilled but not frozen as soon as possible to a state diagnostic laboratory. Direct fluorescent antibody FA testing of the brain is the diagnostic method of choice. Samples to be collected. Point 1. Live animals. Saliva, corneal, a conjunctival smear. To dead animals, the whole carcass or the severed head of the animal suspected to have died of rabies. Example, hippocampus and salivary gland. Differential diagnosis. Canine distemper, pseudorabies, canine hepatitis, listeriosis, cryptococcosis, toxoplasmosis, feline, infectious peritonitis FIP, feline immunodeficiency, virus fever, other infections of the CNS and poisonings due to lead, strychnine, and various pesticides which produce neurologic signs should be considered. Treatment. One treatment is unsuccessful and RV infection is invariably fatal. Point 2. Because of the public health risk, animals with suspected RV infection are euthanized. 3. Prophylaxis. Nervous tissue vaccine, Pasteur's cord vaccine, simple vaccine, beta-propanolactone vaccine, UV-treated vaccines. For null and nervous tissue vaccine, avianized or chick embryo vaccine, tissue culture vaccine. Subunit vaccine, pre-exposure vaccination, pre-exposure vaccination. Schedule for dogs starts at 12th week age, first dose 28 days later, second dose 1 year later, third dose 3 years later, fourth dose. Post-exposure immunization 0, 3, 7, 28, 60, 90 days after exposure.